neurological examination. Because of the extreme importance of the hand in carrying out fine, delicate tasks, and also because it functions as a sensory organ, the detailed neurological examination of the hand and wrist region must be performed. The neurological examination of the more proximal upper extremity, as shown in the video program, the cervical spine and neurological examination of the upper extremities must also be performed. Sensory examination. The skin of the hand is supplied by three main peripheral nerves. Although overlap may be considerable, the median nerve supplies mainly the palmar aspect of the thumb, index, middle, and radial half of the ring fingers, and dorsally the index, middle, and radial half of the ring fingers from the PIP joint distally. The ulnar nerve supplies both the palmar and dorsal aspects of the little finger and the ulnar one half of the ring finger. The radial nerve supplies the remaining dorsal area of the thumb, metacarpal region, and the proximal phalangeal region of the index and radial half of the middle finger. To test the autonomous zone of the radial nerve, check for sensation dorsally in the wedge space between the thumb and the index finger. For the median nerve, check the radial palmar border of the index finger, and for the ulnar nerve, the ulnar palmar border of the little finger. The palmar surface of the hand region can also be divided into dermatomes. C6 supplies the radial aspect of the palm, thumb, and index finger. C7 supplies the mid-palm and the mid-finger, and C8 the ulnar aspect of the palm, ring, and little fingers. Each of these dermatomes must be carefully tested with all of the sensory modalities, such as pinprick, dull, light touch, temperature, warm, and cold. It is extremely important to test two-point discrimination in the hand, which at the fingertip should be less than 6 millimeters. Motor examination. When testing motor function, the examiner is reminded to examine individual muscles or groups of muscles. Palpate the tendon or muscle and record the strength according to the 0 to 5 muscle grading chart, where 0 indicates no evidence of contractility and 5 indicates complete range of motion against full resistance. Always remember to compare the strength of one muscle or group of muscles with its counterpart on the opposite side. Wrist extension. Extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris. C6, 7, 8 radial nerve. Stabilize the forearm and instruct the patient to extend or cock up the wrist, and with the palm of the other hand attempt to force the wrist into palmar flexion. Assess muscle grade on the 0 to 5 scale, and in the normal patient it would not be possible to move the wrist out of the extended position. Flexion. Flexor carpi radialis, C6, 7 median nerve, flexor carpi ulnaris, C8, T1 ulnar nerve. Instruct the patient to make a fist. This effectively eliminates the long finger flexors from acting as wrist flexors. Have the patient flex the wrist and attempt to pull the wrist out of the flexed position. Finger extensors. Extensor digitorum communis, extensor indicis proprius, extensor digiti minimi, C678 radial nerve. Stabilize the wrist in the neutral position and instruct the patient to flex the proximal interphalangeal joints to eliminate any contribution to finger extension by the intrinsic muscles of the hand. Then ask the patient to extend the metacarpal phalangeal joints and test strength by pushing on the dorsal aspect of the proximal phalanx, attempting to push the fingers into flexion. The extensor indicis proprius can be tested individually by keeping the third, fourth, and fifth metacarpal phalangeal joints in flexion. And likewise, the extensor digiti minimi can be isolated by maintaining the other fingers in flexion at the metacarpal phalangeal joints. Finger flexion. Flexor strength must be tested individually at each of the distal interphalangeal, proximal interphalangeal, and metacarpal phalangeal joints, as each of the finger joints is primarily flexed by different muscles. Distal interphalangeal joint, flexor digitorum profundus, C7 to T1, median and ulnar nerve. Stabilize the metacarpal phalangeal joints and proximal interphalangeal joints in extension. Then instruct the patient to flex the tip of the finger. In this manner, only the flexor digitorum profundus is being tested. Test each finger in turn. Proximal interphalangeal joint, flexor digitorum superficialis, C7 to T1 median nerve. With the exception of the finger being tested, stabilize the other fingers in extension and instruct the patient to flex the finger at the proximal interphalangeal joint and test against resistance. In this position, only the flexor digitorum superficialis is acting, and note that the patient is not able to use the flexor digitorum profundus to flex the fingertip. Thumb flexion. Interphalangeal joint, flexor pollicis longus, C7 to T1 median nerve. Metacarpal phalangeal joint, flexor pollicis brevis. Instruct the patient to touch the hypophenar eminence with the thumb. Test the flexor tendon strength by attempting to pull the patient's thumb away from the palm, first exerting pressure on the distal phalanx to test the flexor pollicis longus, then on the proximal phalanx to test both the flexor pollicis longus and brevis. Thumb extension. Interphalangeal joint, extensor pollicis longus, C7-C8 radial nerve, metacarpal phalangeal joint, extensor pollicis brevis, C6-C7 radial nerve. With the palm placed on the table, instruct the patient to lift the thumb up away from the table. Attempt to flex the interphalangeal joint by pressing over the distal phalanx to test the extensor pollicis longus. Pressure applied over the proximal phalanx tests both the extensor pollicis longus and brevis muscles. Intrinsic muscles. The intrinsic muscles of the hand have both their origin and insertion within the hand and do not cross the wrist joint. These include the muscles of the thenar eminence, abductor pollicis brevis, median nerve, flexor pollicis brevis, median and ulnar nerves, and opponens pollicis, median nerve. Hypophenar eminence, abductor digiti minimi, ulnar nerve, flexor digiti minimi brevis, ulnar nerve, and opponens digiti minimi, ulnar nerve. Other intrinsic muscles of the hand include the adductor pollicis, ulnar nerve, lumbricals, median and ulnar nerves, and dorsal and palmar interossei, ulnar nerve. Thenar eminence. The muscles of the thenar eminence are tested as a group by asking the patient to touch the thumb to the tip of the little finger so that the nails are parallel. They can also be tested by having the patient place the dorsum of the hand on the table and raise the thumb so that it is at right angles to the palm. By palpating the thenar eminence during either movement, the examiner will be able to appreciate the contraction of the thenar muscles. Thumb adduction. Adductor pollicis C8T1 ulnar nerve. Instruct the patient to hold a piece of paper with both hands between the thumb opposed to the radial side of the proximal phalanx of the index finger and to pull the hands apart. Weakness of the adductor pollicis is manifest by flexion of the interphalangeal joint of the thumb, and this is called Froment sign. Hypothenar eminence. Instruct the patient to bring the little finger away from the ring finger against resistance along the ulnar border and palpate the region of the hypothenar eminence. Finger adduction. Dorsal